Hi, it's Michael Goldberger. I am one of the foot and ankle specialists at Tri-County Orthopedics. The Achilles tendon is a fibrous cord which connects the muscles of the calf to the heel bone. It is used every time you take a step to push off. Common injuries associated with the Achilles tendon are Achilles Tendinitis, which means inflammation around the Achilles tendon. You could have micro tears or partial tears of the Achilles tendon. In addition, the most extreme example is a rupture of the tendon itself. Common symptoms of Achilles tendon injuries, first of all, is pain in the back of your Achilles tendon. Two, many times when a patient stands up, they'll feel stiffness either in the morning or when they first start walking on it. They may notice worsening pain as they continue to exercise. Many factors can contribute and trigger an Achilles tendon injury. Most commonly, a rapid increase of speed or mileage can contribute to an Achilles tendon injury. If suddenly you add stairs or hill climbing, if someone who has a natural predisposition for muscle tightness and starts running quickly can cause an Achilles tendon injury. And lastly, if you worn a pair of sneakers, that can also contribute to this. You should see a specialist for an Achilles tendon injury if you're still having pain in the Achilles tendon area after 2 or 3 weeks of rest. In addition, if you have a sudden sharp pain or hear a pop and have difficulty walking, you should immediately consult a doctor. Non-operative treatment for Achilles tendon injury is the mainstay. First of all, rest from the activity which was causing the problem. So if you were a runner and also you decide to start swimming or biking, that's appropriate. 2, you can add a heel lift or an orthotic into your shoe to take some of the tension off the Achilles tendon. 3, a stretching program either by yourself or with a physical therapist. Next, you can take some anti-inflammatory medicine, and that also will be effective. Surgery for Achilles tendonitis is typically the treatment of last resort. Many times, the sheath around the tendon becomes thickened and fibrous. Surgery essentially releases that sheath and repairs any micro tears. In a patient who has a rupture, especially in someone who's very active, surgical repair is typically preferable to non-operative treatment. Lastly, if you have a chronic tear, many times you need to have a new tendon replaced called a tendon transfer. With modern surgical techniques, we expect a full recovery with Achilles tendon injuries. Typically, when simply Achilles tendinitis and we release the sheath and repair micro tears, we can, after a short course of immobilization, we place them in a camel walker or walking boot and we start physical therapy immediately. In someone who has Achilles tendon repair after rupture, typically there's a 2 to 3 week course of elevation and non-weight bearing, and then weight bearing either in a cast or walking boot with aggressive physical therapy thereafter. Within 6 to 9 months, we expect a full recovery.